How can I tell the difference between reflux and colic? Reflux and colic can have very similar symptoms, but they're very different conditions. Reflux occurs when the sphincter between the stomach and the esophagus is loose, and it allows regurgitation of the stomach contents back up into the esophagus. The stomach contents are acidic, so can cause burning and discomfort, much like an adult with heartburn. Sometimes reflux results in copious vomiting after and between feeds, which may or may not be accompanied by bouts of crying. Not all reflux babies cry. Some are just happy chuckers. Silent reflux still has the regurgitation, but the stomach contents are swallowed back down. This can mean that the baby gulps a lot during feeding. Reflux babies can be fussy feeders where they come on and off the breast and have bouts of crying in between. Reflux babies often have problems gaining weight due to interrupted feeding and vomiting. Colic, on the other hand, is a result of immature gut. Babies are born without digestive bacteria, and the development of gut flora in some babies can be quite slow, which results in undigested milk flowing from the stomach into the bowel, where it ferments and causes pockets of gas. These pockets of gas cause pain and discomfort as they travel down the bowel until the trapped wind is passed out. Colic is not the result of gas bubbles in the tummy. These can usually be burped out. Mums of colicky babies often comment that their babies seem to be just full of wind, and they are. 40% of newborns can suffer colic symptoms in their first few weeks of life, and this percentage increases to 70% following a Caesar birth. This is because there's no exchange of fluids in the birth canal, and hence there's no seeding of the gut. Also, antibiotics are often used for mums and babies before, during or after a Caesar to prevent or treat infection. The antibiotics can kill off the developing gut bacteria and delay the digestive development. The wriggling and squirming and grunting in newborns can occur in both reflux and colic babies, which can confuse the diagnosis. And some babies are unfortunate enough to suffer from both conditions. Copious vomiting usually indicates reflux, but it can also occur in colicky or overfed babies. Babies outgrow both these conditions, but the weeks of suffering until they do can be very daunting. Reflux settles as that sphincter tightens, and colic will settle when the baby's digestive system can cope with the feeding schedule. My advice is to seek help, and seek help early.